Thank you for joining us for our presentation on neuroscience approaches to mental health treatments by Misty Hughes-Alatheo, Jessica Campbell, Margot Skellinger, and Cynthia Corey.
Today, our team is going to share a brief overview of neuroscience. It has become a popular evidence-based field used successfully in counseling. The use of neuroscience in our counseling practices opens doors to healing that did not exist 20 years ago. The acceptance of this approach has been controversial. The efficacy of neuroscience has been questioned by insurance, making it difficult for clients to pay for these procedures and techniques. With neuroscience evolving and research becoming more readily available, access to neuroscience services are more foreseeable here in the near future. My name is Cindy Corey. I will begin with a brief overview of neuroscience. What is neuroscience? Neuroscience is a very broad study of the brain and nervous system and their functions. The division of neuroscience we are most interested in is how the brain and the nervous system affects our behavior. The cerebrum and the limbic system. The cerebrum is the largest part of the brain. It is located in the front area of the skull and has two hemispheres, the left and right hemisphere. The cerebrum interprets information that comes into the brain through the senses. It controls thoughts, memories, speech, movement, and functions of some of our organs. The cerebrum consists of the cerebral cortex, the frontal lobe, occipital lobe, parietal lobe, and the temporal lobe. Each hemisphere, the cortex, and each lobe of the cerebrum communicate with each other and work together. Each has their own specific jobs. The limbic system is involved in all behavior and emotional responses. It consists of the amygdala, the cingulate gyrus, the hippocampus, hypothalamus, olfactory cortex, and the thalamus. The neurons and neurotransmitters. The neurons are made up of a cell body, which acts as the brain of the neuron, an axon, which carries the impulses to the other ends of the neuron, dendrites, which are at the ends of the neuron, and at the very end of the dendrites is a gap between either the next nerve or the target cell. This gap is called a synaptic gap. In this gap, the neurotransmitters are released or taken up into the next site. The neurotransmitters are chemical messages or signals that are transferred by the neurons throughout the brain and the entire body. The neurotransmitters are acetylcholine, glutamate, gamma-aminobutyric acid, or GABA, glycine, dopamine, adrenaline, which is also known as epinephrine, noradrenaline, also referred to as norepinephrine, and the last one is histamine. Each neurotransmitter has its own job to perform. History of neuroscience. Santiago Ramón y Cajal was a Spanish neuroscientist, histologist, pathologist, and artist. He is considered to be the father of neuroscience. Cajal is known for discovering that nerve cells are independent from one another, and they form the foundation of the nervous system. Dr. Donald Hebb, psychologist, is known as the father of neuropsychology. He developed a theory about cognitive processing called Hebbian theory. Dr. Eric Kandel is a neurobiologist and is best known for his study of the brain and its effects on behavior. He discovered that the brain changes when memories are being formed and stored.
Hi, my name's Misty, and I will be discussing the research of neuroscience with you today. I'd like to draw your attention to the picture of the drawn neurons on the right-hand side. This was drawn by Santiago Raymond y Cajal in 1899, and he is considered the father of modern neuroscience because he was the first to capture in his drawing neurons and different brain regions within his drawings that we now see today shared within the advanced brain imaging technologies that we have. In layman terms, neuroscience looks at the function of the brain and nervous system. Neuroscience research in general covers several areas. For the most part, it encompasses first cellular and molecular neuroscience, which studies neurons and their physiological properties at a cellular level, as well as the biology of the nervous system. Second, it covers systems neuroscience, which examines a neural systems and circuits. Then we have computational neuroscience, which looks at brain structure development and functioning through mathematical models, computer simulations, and theoretical assessments. Next, we have translational and clinical neuroscience, which focuses on the fundamental mechanisms that underlie diseases and disorders of the brain and central nervous system, and methods of treating them. Now let's move to cognitive and behavioral neuroscience, which studies how biology produces psychological functions and the behavior that ensues. And lastly, we want to look at neuropsychology, which combines both neuroscience and psychology. Neuropsychologists focus on the relationships between the brain and the neuropsychological function. The collective research from all these varying areas has allowed us to understand the brain and nervous system's role in neurological, physical, and psychological functioning. The combined efforts and research from all these mentioned fields have produced groundbreaking research and treatments for common conditions that affect mental health and behavior, such as Parkinson's disease, Alzheimer's disease, Huntington's disease, schizophrenia, clinical depression, autism, anxiety, and substance abuse. So, why does the relationship of neuroscience and psychology matter? Well, research shows us that there is a direct correlation between biology and psychology when we evaluate the functioning of the brain and one's behavior. With this information, we can elevate a client's care by acknowledging both disciplines that have an effect on the client's state. They truly complement each other by answering questions around cognition and behavior, neurodevelopment, neuropsychopharmacology, and plasticity with development of new neural pathways. Understanding how the brain works and having a better grasp of neuroscience techniques allows the clinician to implement modalities and goals that are more effective and suitable to the client. Now let's take a look at the 7 foundational principles for cognitive behavioral neuroscience approaches that we might utilize in therapy. These derived from neuroscience research by Donald Hebb. Principle 1 is neuroplasticity, which is the brain's ability to change and to develop in response to its environment and the demands being placed on it. Neurofeedback creates new neural pathways through playing video games that train the brain as a result of this discovery. Principle 2 is automaticity, which occurs when a skill or process becomes embedded in procedural memory. Neural connections are strengthened by repetition, leading to automaticity, which can be created through neurocounseling techniques. Principle 3 is integration, which is often called cross-training. It is the repeating of a multiple skill over and over, which can lead to improvement in those skills and ultimately automaticity. Principle 4 is progressive challenge, which looks like sequence challenges that address the range of each individual's strengths and weaknesses to provide the appropriate levels of challenge and intensity. We can see this with the adjustment of rewards and inhibitors with amplitude training and neurofeedback. Principle 5 is frequency and intensity, which refers to the frequent practice with intensity that leads to automaticity of skills. We see this in a software program called Brain Builder that adjusts its difficulty as the user progresses in the multiple games that increase auditory and visual processing and memory recall. Principle 6 is feedback. Immediate feedback is necessary to allow for error correction and faster, more accurate learning. Human feedback through coaching, along with reinforcing feedback from neurotech devices for treatment, typically will reward the client by building new neural pathways with sounds or vibrations. Principle 7 is engagement. Stimulation is an important factor in motivating attention and meaningful participation in a learning activity. Persistence motivated by feedback loop reinforces and supports the natural mechanisms in the brain that reward us for accomplishing something challenging. Ultimately, the client must be engaged and find the neuroscientific treatment interesting and rewarding. Overall, these 7 foundational principles for cognitive behavioral neuroscience guide us as therapists in our approach for treating clients with negative. Future neuroscience research should continue to study how biomarkers from MRI scans can indicate mental health risk and mental health resiliency. In addition, they should continue to document biological changes in the brain with experimental medicines for mental health. They should also identify where and how the brain changes in relation to a client's response to treatment. And finally, they should link treatment-related brain changes to behavioral outcomes for future studies.
Hello, this is Jessie, and I will be covering the aspect of neuroscience and religion. To start with, we will first look at the field of neurotheology, also known as spiritual neuroscience. It is defined by Seidman Sauer as the study of religion and the effects of its beliefs on the human brain. It encompasses things in the multidisciplinary field such as religious studies, practices, and experiences, theology, neurosciences, psychology, cognitive sciences, and philosophy. Since we have already learned about what the basis of neuroscience is, I will not repeat that here, but we do need to understand just what theology entails. Again, for author Seidman Sauer and other scholars, this is defined specifically to include only religions that are God-centered, such as Judaism, Christianity, and Islamic. Some, such as Hicks and Newberg, take the broader approach and include any religious practices with a set of values and traditions. For neurotheology's brief review, we will concentrate on 3 aspects: holistic, quantitative, and binary. For the understandings of holistic nature, we derive this from our right brain hemisphere and make things such as grasping overall concept of theory more feasible, rather than trying to understand specific details of what comprises all things, such as Seidman Sauer explains. In the quantitative aspect, it's basically an understanding that mathematical equations help our brain to relate to objects around us. This kind of learning is loosely based on how the scientific method works and is rooted in left-brain thinking. Binary functions allow our brains to identify 2 contradictory ideas that both Hill and Seidman Sauer report. religious practices and knowing the differences between such things as right and wrong, good and evil, and the difference between man and God fall into the category of these binary ideas. Religious benefits of physiological components from findings that include the heart, where coronary heart disease was shown to be decreased in 63% of studies that Koenig reviewed included religion and spirituality as a helping factor. When the studies Koenig compiled looked at hypertension or blood pressure, it was also reported that 57% of those with religious and spiritual beliefs had significantly lower blood pressure than those without religion. In the brain factors, both risk of stroke and the effects of Alzheimer's and dementia were shown at decreased levels compared to patients who claimed no religious or spiritual practices. There are other physical health benefits that the compilation of studies reviewed by Koenig revealed as well, but in lesser significance. Those include better immune and endocrine functioning, higher regulatory brain functioning, as Newberg found, and a greater survival rate of patients suffering from cancer. The clients benefit from most religions by teaching caring others and practicing putting others' well-being to the forefront of the mindset. This is referred to as social capital by Koenig and is not only beneficial to the clients themselves, but the community around those who practice. Many characteristics that are beneficial to those who practice theistic religions often include a positive outlook on exercises, healthier diets, and less reported smoking, which decreases overall stressors. From the counselor's practical viewpoint, including religious practices and its importance to our clients have the obvious advantages of both physical and psychological, as we have discussed earlier. In the personal realm, we can also decrease our own sense of stressors when we allow ourselves to practice our religion in conjunction with adhering to our governing code of ethics. This is in the same manner that doctors allow their personal religious outlook to benefit patients they are seeing by imparting them with some education about the ways their own religious benefits can help increase overall health, as Koenig suggests. So, does neuroscience increase the religious experience? There is a need for more studies on this topic since the current research has not yet covered that aspect. Only in one study found by Mueller did someone show a positive influence in neuroscience toward growth in religion with the VMAT2 gene that had a C allele present. It's dubbed the spiritual allele and is thought to be responsible for the transcendent experiences in the highly religious. Does it decrease the experience of religion? Studies in neurotheology at this point are generally either trying to disprove religion or at the very least staying very neutrally ambiguous. It is the position of some to try and divert religion and scientific understanding in a positive manner. Hicks even goes on to conclude that any religious transcendence can be explained by materialistic causes and that religious experiences could be a direct result of just delusions. That kind of derogatory representation may cause some pause or decrease in their beliefs of spirituality and religion. So what do we know about this overall? Newberg in his research concluded that neuroscience and neurotheology may not either prove or disprove religion, but it does help increase the understanding of the meaning of what it is to practice and be in one's religion. It seems like the overall approach to this particular field of study is just to keep an open mind on both sides of science and religion.
Hello, my name is Margot Skellinger, and I will be sharing with you this evening information on the benefits of counseling in neuroscience. There is brain mapping, which assists with brain waves, and the brain waves affect our everyday behavior, from our insight, our learning, our ways of relaxing and resting, dreamless sleeping, and healing. We need our brain waves to allow us to keep our brains in an organized rhythm to benefit our clients. This also lets counselors know which brain waves need to be addressed, increased, or decreased. Then there is brain spotting, healing all the layers, and you will do it one layer at a time, targeting one location at a time. It can benefit those that have anxiety, sleep disorders, and depression, along with many others. EMDR is my favorite, as it is used with trauma. I utilize this for myself through childhood trauma. My ACE score was very high. From EMDR, I moved on to CBT and DBT. CBT was my next favorite because mindfulness was my key, because it was the key to making changes. I had to make changes mindfully and had to be consciously making changes to change my behavior. The last one that I have on my list for this evening is one called Neurofeedback, and Brittany Logans shares with us the most significant benefits of neurofeedback therapy is that it can display the brain's inner workings. This shows reactions to things in therapy that can display brain's inner workings. This can show reactions to things we weren't consciously aware of, which can help us identify unhelpful behaviors and work to change them. This helps to regulate our systems and improve our mental health. Neuroscience, a developing force in counseling by Bob Skibick. Over the years, 5 fundamental forces or approaches that have influenced the direction of counseling. Neuroscience is on track to becoming the 6th force, which was stated in 2017. This is critical perspective, knowledge, and guidance. Although some counselors may strongly align themselves with a particular approach, most recognize the value of drawing on the insight offered by different theories and modalities. Wise counselors make informed choices based on clients' needs and situations. 6 key forces in counseling. Psychoanalysis focuses on helping clients develop understanding and insights on their thoughts, behaviors, feelings, along with turning negative into positive. Behaviorism looks at human behavior as a product of learning and the environment. Humanism is based on the viewpoints of the people driven towards growth and fulfillment. Multiculturalism involves framing counseling intervention in the concept of our clients' cultural worldviews. Social justice recognizes the importance of counseling working to help establish more equality among the different social economic statuses and offering opportunities. Neuroscience includes the central nervous system, which is the brain and the spinal cord. This is where the brainstem is an essential part of the brain. By Bruce Perry, MD and PhD. Neurobiology growth can affect all body parts, from the body temperature to the behavior and emotions to your thought process. View how your brain stem is in control all through your body. These all have a means of healing trauma, depression, anxiety, relationship, guilt, and shame. It starts from the bottom up. Neuroscience and neurobiology focuses on the study of the brain, the nervous system. This is important to allow the counselors to know how the brain will operate. Once all of these have been identified, this can make the counseling process go smoothly for both the client and the clinician. Counselors may benefit from neuroscience to understand the brain, its development, connection, and influences. Counseling and neuroscience are merging.
In conclusion, we have covered the main elements of neuroscience here today. The comprehensive history and research around the vast field of neuroscience depicts a theory and techniques that have significantly impacted those struggling with mental illness. Neuroscience treatments offer hope to retrain a client's brain while strengthening positive neural pathways that promote healthier thoughts and behaviors. In addition, it has been proven that by using a combination of neuroscience and religious beliefs, the medical and psychological fields help create better balanced, efficient individuals who can be a guiding influence of transformation within families and the community.